Right, guys. Hello.
Hi, everyone.
How's everyone doing? Can you all hear us? I hope you guys can hear us. If you can hear us, raise your hand or something. I don't know.
Like
No.
on the Zoom thing. Oh,
There we are. We got raised. Thanks, guys, for raising your hands.
yay.
Okay, so just to introduce myself. My name is Sarah or Sarah. I'm a tutor here at Intermedicine, and I'm also a medical student at Imperial College London. Me and Muna, we're both just about entering our third year at Imperial, and we essentially wanted to do this webinar and start this initiative into medicine for loads of reasons. I think, Muna, do you want to introduce yourself before I go on?
Yeah, my name is Muna. Sarah said we just finished our second year, so we're about to enter our third year at Imperial College London, and we're both tutors at Into Medicine, which we both started together. You can carry on.
Yeah. So just a little bit about Intermedicine. So Intermedicine is a project that me and Mona worked on, like we said, in order to help prospective medical students kind of get into medicine. We remember how hard the process was applying for medicine. We know exactly how daunting it can be, and it can be especially difficult for those people that don't have the resources or the expert people to help them or to assist them, or don't maybe come from schools that offer that kind of support. So what we wanted to do, we wanted to provide a platform that allowed kind of an affordable service through tutoring, webinars and courses to kind of level the playing field. I think if we just want to promo our UCAT course, that's on Monday. So we have our first UCAT course on Monday. It's the verbal reasoning section of the exam. That's what we're going to focus on. We're going to go through all the tips on how to master that section. We remember how hard that section is. I think it's the #1 section that people get the lowest scores on. That brings their average down. But there's so many ways you can master that section. So if you want to join us on Monday, please go on intermedicine.co.uk. I think you can see it on the screen there, hopefully. And yeah.
Another thing is we also have a few social media pages. So we have an Instagram account, which is at into.medicine. So everything that all the events that we have coming up, we're going to share on there. So if you would like to follow us there, please do. We also share lots of different information that we want to put out there to help you, basically. So recently we've started a wider reading sort of series on what you guys can do this summer in terms of wider reading for your personal statements and interviews. So please follow us there. Follow us on our Facebook page, Into Medicine, and Twitter. We'll have all the handles and stuff at the end of this presentation, don't worry. But just quickly, our next 2 webinars will be at this time next Wednesday and the Wednesday after. This time next week, it will be on the coronavirus and how the coronavirus is impacting your applications and what you guys need to know kind of for your interviews and stuff in terms of the coronavirus pandemic. And the week after that, hopefully we'll be having a guest speaker who is a doctor, it will also be a Q&A type thing. And you can ask about a day in the life of a doctor, basically.
Yeah. Sorry, man, I think there's those people trying to get into the webinar.
Is there?
But
is it not letting them in?
I think it should work now. Yeah, so as Mona said, I think it's letting them in now.
Is it? All right.
Yeah. So as Mona said, that's with all the webinars and the courses we have coming up. To focus on this webinar, we're going to go through our experiences of medical school, the application process, how we got into medical school, everything we did to kind of from the UCAT, BMAT, personal statement, all of that business, and then to the actual stuff you guys want to hear about, what it's like to be a medical student. Feel free to ask us any questions throughout the presentation or the webinar. I think there's a Q&A segment, like there's a function on Zoom. So if you just want to ask your questions on there, and then we'll answer them all at the end of the session, like the last 15 to 20 minutes. And yeah, I think we should start off just by talking about our experiences. So the actual application process of medicine consists of different factors. You should take in all those factors into consideration when you're applying. It's really important that you take into account your predicted grades, your UCAT, your BMAT score, your personal statement, your work experiences, your volunteering, all your volunteering experiences that you've kind of done. And it's really important that you showcase your passion towards medicine and science and the humanitarian side of medicine as well, whilst you're applying. So through, you know, work experience, volunteering, like I said, but also through wider reading, through doing extracurricular stuff like presentations at school, you know, all the stuff that you can prove to say that, you know, I really do want to do medicine, like what makes you stand out, essentially. My personal experience when applying for medicine is actually quite kind of cliche, textbook. I did maths, bio, chem, your typical, and then I did politics A-level and Arabic A-level. Yes, I did 5 A-levels. Please don't do 5 A-levels. Don't even like think
It's just a bit extra. You don't have to do that, please. Stick to 3 if you guys want.
Arabic wasn't a choice. Politics was something I wanted to do. And then the 3 that you have to do, bio, chem. I don't think you have to do maths, but I think most unis prefer it anyways. And yeah, so I sat my UCAT at the end of July, and I did my BMAT in November. I did the November BMAT because when I was applying, you weren't really allowed to do the September one. I think only like 3 universities accepted it at the time. I think now they're being more lenient. Something to mention, the UCAT applications have now opened today.
Yes.
I don't know if you mentioned it.
As of 9 a.m. today, they've opened.
So if you haven't booked it, book it now. It's, I think if you book it now and you set yourself a deadline, it'll be easier for you to revise for it. And it's really important you do actually revise for it. I think Mona will tell you why. But yeah, my UCAT, my BMAT, and then I wrote my personal statement from basically the summer holiday of year 12 to year 13. And yeah, and I did loads of like extracurricular and work experiences and stuff like that. I was lucky in the sense that my school helped me through like setting up medical societies and stuff like that, so it encouraged a lot of extracurricular. And then I did my interviews. I got my interviews at really random times of the year. I got one in December, then one in January, one in February, and one in March. I applied for medical schools all in London because that's what I wanted to stay in London. So because I had achieved a good score in my UCAT, I knew I had a good chance at applying for UCAT universities. So I applied for Queen Mary, King's and St. George's. And then I took my chance with Imperial with the BMAT. And yeah, and I firmed Imperial and I insured King's, and then I'm at Imperial now. So it was not something that interesting, but it's a process.
Yeah. I'm kind of a similar story, except I only did 3 because I'm normal A-levels wise. I did biochem maths, and yeah, honestly, a really similar story. I tried my best to do as much like volunteering as I could, to be honest, during around year 12 time. So I could put that in my personal statement, and it was useful in terms of like, you know, figuring out if I wanted to do medicine, you know, in terms of going to care homes and stuff like that. So I'm a similar story, but I ended up applying to, I didn't apply to just London universities, I applied around the country. I ended up getting 3 out of 4 offers, and then here I am, Imperial at the moment. But yeah, essentially a kind of similar story.
Yeah. I would say for general advice, one of the main things that I struggled with when applying for medicine was my personal statement. I think that was the hardest part for me. So I would say start early and just like write all bullet points of everything you possibly done that could help you be a better medic, and just write it all down and how it's helped you, how it's made you a better person, all the skills like communication, empathy, everything, and like showcase your passion through that. But I wrote like 20 drafts of my personal statement. I didn't like it. I hated writing my personal statement. I'm not a humanities person, so like I struggled a lot. I had a lot of people help me write it. Like, not help me write it, but like look over it and like tell me if it's right or wrong. And yet, promo, we've got a personal statement course coming up. I think it's on the 24th of July. You can check on our website. But yeah, I think personal statement is one of the things that I struggled with. So for general advice, start your personal statement early, so you don't have to stress in September when you're revising for your BMAT.
Yeah, in terms of my own advice, I think the best piece of advice that I was given before applications was from someone in like the year above or something, in year 13, and they basically said that you should apply strategically, in the sense that you could have strengths and weaknesses in your application. So personally, I didn't do very well in my UK CAP, probably should have prepared more, but yeah, so I ended up applying more strategically. So I avoided universities that I knew really emphasized high UK CAT scores. So those universities like King's or maybe Queen Mary's and Barts London. So yeah, I would say to look at your own strengths and weaknesses and assess them. And then go online. I'm sure on the websites for their own universities, plus other websites such as the Medic Portal. If you guys haven't heard of that, the Medic Portal, I lived on that website for my entire application. It has loads of like blog posts and articles and stuff with advice for which unis look for what, as well as loads of other things, to be honest. But yeah, so look at that, and that would be my advice. So I avoided those, and I applied to universities that looked for more, that kind of tended to focus more on grades, such as Birmingham. So yeah, also another quick thing is that obviously because of the times that we're in, stuff is a bit more tricky with you guys in terms of work experience for everyone who's applying now. My advice would be look online for opportunities to do virtual work experience. It's actually amazing how many different initiatives there are to do online work experience. Off the top of my head, I can think of a few. So there's an Instagram page called We Are Medics, who have a few posts about some ideas. I know that the Royal Society of General Practitioners is doing some virtual work experience opportunities. And yeah, I'm sure there's other things again on the Medic Portal or other places. So I would say look for those, and you definitely have to like at least attempt to do that, so you have something to write in your personal statement. So yeah.
So we're gonna go on to, if this Prezi wants to go on to it. We're gonna go on to essentially the meaty part of the discussion. We're gonna start talking about what it's like actually being medical students. So once you've achieved the grades and you've gotten the offers, etc., etc. So we're going to start talking about the preclinical years. So what we mean by preclinical years is we mean the years that you spend setting down your scientific foundation for medicine. So you learn all the textbook learning stuff, anatomy. They're very lecture heavy, very tutorial heavy. You basically learn the biomedical side of medicine and the biochemistry side of medicine through pharmacology, and all whilst kind of incorporating the treatment and the, I want to say basic, but like the simple to understand diseases or the common ones. But you don't get to see much clinical exposure. But that was our experience with the old curriculum. I know the new curriculum. So at Imperial, me and Mona do the old curriculum. The new curriculum was introduced last year. They do a lot more clinical stuff in first year and second year, but they're still deemed, first year and second year still deemed preclinical years. Different universities will have different things they do in the preclinical years, but it's all kind of the same basic level. I think, Mona, do you want to talk about the new curriculum?
Yeah, essentially in the new curriculum, it's kind of like you end up learning the same old stuff. I know like medicine hasn't really changed all that much in terms of, you know, anatomy and biomedicine or whatever. So you end up learning the same stuff, but they've tried to include a lot more clinical exposure just to get everyone kind of used to interacting with patients and talking to them at an earlier stage, so that it's not as much of a shock. Previously, like more traditional sort of courses, perhaps like the ones that you'd find at Oxbridge or something like that, they would previously have very little clinical exposure. So it would be quite a shock when you reach year 3 and you'd have to, or year 4 or whatever, and you have to start talking to patients. It's quite difficult and a bit daunting. So that's why they've introduced that, just to get everyone used to it. So some examples of clinical exposure would be in first year now, you have a few weeks at a hospital, which department depends on your own allocation. A few weeks at a GP, I believe, or maybe like one day a week for a few weeks at a GP. And what you do essentially is talk to patients and learn how to take a history and things like that. Also, you might be assigned, depending on your university, you might be assigned a patient to meet with outside of like these sort of environments, and you talk to them about their experiences with the NHS. They're like volunteering to do this to help you, but and then you would write some sort of write up about it. That's basically coursework. So yeah, essentially that is the clinical exposure that we have.
I think
Yeah.
something to mention about preclinical years that most universities are now incorporating is the case-based learning PBL.
Definitely.
So I think lectures are quite self-explanatory. You sit in a big lecture hall, some guy comes and he teaches you this PowerPoint, and then you're meant to like absorb all of it. But what they're trying to incorporate is something called case-based learning, or PBL. I think Mona knows more about it because the new curriculum, and most universities now incorporate it a lot more. Yeah.
Definitely. So PBL is basically, I'm sure a lot of you would have heard of this anyway, but I'm going to explain it. So it's problem-based learning. Sometimes there's something called case-based learning, which is very similar. I don't really think that there's much of a difference. So you might have heard of CBL as well. Essentially what it is, you're put into like classroom sizes rather than a big packed lecture theatre. And in these classes, you're assigned a case. So it could be, for example, there's this patient, he arrives at this hospital with these symptoms, here's the x-ray, here's the blood tests, here's the physical examination results. And then from that, you have to come up with your own learning objectives. So it's quite like self-directed learning, essentially. You have to like kind of almost teach yourself, but not really. It's kind of, it supplements the lectures. But so you come up with your own learning objectives, you go home, either individually or in pairs, you like work on that learning objective, you come back, present it, and together you come up with a conclusion or a diagnosis. And that has increased in recent years. Again, as Sarah mentioned, there are some universities that do it way more than others. So yes, we personally did it maybe once or twice a week, but I know it's more often in the new curriculum. And it's also assessed nowadays, so you might have a written examination on it once a term, and that counts towards your end of year mark. So yeah.
I think one thing to mention with the PBL is if you know a university is taking PBL to like next level's seriousness, like for example, I know Queen Mary do like most of their teaching via PBL and CBL, then it's something to mention in the interview. So if you go on the website for all the universities that you'll apply for and you write in medicine and then you go through all the modules they do, or just, you know, just the explanation they give about degree, they'll tell you like if they do a lot of PBL or integrated study. So it's something to mention in the interview. Say, I want to attend your university because you do a lot of problem-based learning. I know that learning method itself is something that is suited to me, etc., etc. There's something you can mention in the interview because they'll really see you as someone special, I guess.
Yeah. One more thing about PBL is that the reason why you could be more interested in that form of learning is because it's very similar to what you would expect as a practicing doctor. Like people would come in with a case and you have to review their case and their history and their test results, and from that come up with a solution, which is why, like, because of this like similarity between the teaching style and the actual style of working that you will end up having is becoming a lot more popular. So that could be a reason why if you could be more drawn into it.
Yeah, so and there's one thing else to talk about PBL is how it incorporates everything that you basically learn in the lectures, you learn in tutorials, in communication skills. So you're expected, I don't know if Mona mentioned what we kind of did with PBL, but
you can explain.
Yeah, you're kind of expected to, so we had, one of our cases was about sickle cell disease, and we were learning about sickle cell in all the lectures, but we were also doing a lot of communication work in Foundations of Clinical Practice module. So we were expected to not only kind of learn the symptoms and the treatment and the kind of course of action with sickle cell, but also like do like a role play of how would you break the news, what would you do with the family members? Would you test them, etc., etc.? So it's all like, it's a kind of like a roundup of everything you learn. in one case.
Mm-hmm.
But yeah, I think that's all we have to say about
Yeah.
PBL. But it's something really important that you should take into consideration when you're applying for unis,
Definitely.
and something that you should talk about in your interviews. Something else that I want to mention was labs. Now, labs experiments are done very seriously at Imperial, probably because it's Imperial and it's like a research university. But we get to do a lot of like histology, pathology, looking down the microscope at different samples, and all of that is really helpful when consolidating kind of things you learn in the lecture theatre. So I know when we were doing lectures on cancer, we were able to look at cancer cells under the microscope and stuff like that. But I think most medical schools do that. But I think what kind of makes Imperial special with their labs is we get to do a lot of like
interesting things.
So
they're really fun, actually.
They're really, really fun. We take like bloods from each other, and then we look at our own bloods or centrifuge it, and then look at our own bloods under the microscope. We take drugs, like eye drops in the eye, and then we, like, our vision is distorted, and we have to say like why.
Yeah.
Like we take like beta blockers and then go on a treadmill or like a bike and then see the differences between beta blocker and non-beta blocker. So it almost feels like we're part of an experiment, but that's what labs are at Imperial. They kind of they push you to prepare yourself for like research work. Yeah. So at the end of every lab, or like a particular lab, they make you do a write-up or a lab report, do a lot of data analysis. They prepare you for the life of like intercalation, and intercalation is something that Mona is going to talk about later on, but it's basically the year you take out when you, in the middle of medical school, you do something else. But it kind of prepares you for research work and like publications, like I said, and all of that business, which I think is such a fantastic thing that Imperial does, because it gives us the opportunity to kind of be almost ahead of everybody else in that field. But it is harder work. Lab report is
the writing up.
The write up is probably the worst part of the year. I don't enjoy the write up. I enjoy taking the drugs, not the write up.
Not so much.
Yeah. We get to also do like PCR. So like PCR, I'm sure most of you guys have heard of it because A-level bio and chem. But if you're not, it's basically just like, what is it, reproducing cells essentially. Yeah. And so I know like loads of biomedical students and biochemistry students have to do that, but medical students don't. But at Imperial, we do it as well. So it's kind of like part of our preclinical years theme. Something else that I want to talk about is anatomy. So anatomy is something else that we do in preclinical years. At Imperial, we don't do it after second year. It's only done in first year and second year. And anatomy essentially includes dissections. So Mona and myself did full body dissections. So Mona and myself did full body dissections, whereas I think the new curriculum only do prosections.
Yeah, they're more heavily based on prosections. We also did prosections. So for everyone who doesn't know the difference, prosection is basically when you have a pre-prepared like part of a cadaver or something like that. And dissection is when you basically kind of have to do like hands-on stuff for yourself a bit more. So like, you know, cutting or whatever. It sounds a bit squeamish at first, and trust me, the first time a couple people fainted. It was fancy. It's a story for the grandkids. Yeah. But like
people complain like till today, like literally even in second year, after 2 years of doing dissections, you go into the dissecting room, you smell the formaldehyde, you smell the chemicals, and you think, no, not today.
It's fun. I enjoyed it personally.
Yeah. I think it's a bit of a shame that people don't do full body dissections, because it was quite an experience to put, how do I say this without sounding weird, but like put a scalpel to the skin and like feeling how it felt, and like actually like dissecting, actually going through the skin and the fascia and the muscles and actually seeing all the layers before getting to the region that you want to get to.
It is a great hands-on experience. You don't really see it in a lecture. Like it kind of puts everything into perspective in terms of anatomy, because it's hard to learn anatomy from a textbook, which is why they do pro sections, so that you can be like, oh, that's what it actually looks like. So yeah.
Yeah. I think something else that they've now introduced is anatomy spotter exams. So they'll like, for one of the exams, they'll actually take you into the anatomy room and then like point at something and be like, what is that? Which is actually really difficult because all the muscles look exactly the same, especially if they're one on top of the other. But yeah, so that's something that if you were to do medicine at Imperial, something to anticipate.
Yes. Okay. The next thing is tutorials. This is done differently at different universities, but essentially there's not really much to it. It's kind of like classroom learning, which you guys are used to at school. What would happen is they put you in tiny classrooms and you basically go more in depth into something that they mentioned in a lecture, or something like a bit different, but works alongside what you've learned in the lectures. And it's actually, like, personally one of my favorite ways of learning, because it's, in a lecture theatre, it's really difficult sometimes to keep track of what's going on, especially if, say, you get lost in the beginning, then you kind of don't understand what's going on for the rest of the time, or you could just fall asleep in lectures, as I have often done. In tutorials, it's a lot easier to actually, it's embarrassing, but in tutorials, it's a lot easier to like just say to the person who's explaining to you, who will be sometimes a professor, or I don't know, some sort of doctor who knows what they're talking about. They would explain things to you and like slow down for you. They're really lovely. So they would explain it in a way that you need. These topics are generally explored in exams in a bit more detail because they expect you to know it a bit better. But yeah, it's essentially not much to it, as I said, kind of like a classroom, like 12 people or so would be in there. So yeah, that's tutorials. Intercalation is the final thing we wanted to mention in terms of preclinical. So a lot of universities have 5-year medical courses. So some have a 6-year course. So the 6th year would be the intercalation course. Different universities do it differently. Some are compulsory, such as Imperial, some are optional, and some don't offer it. So essentially what it is an extra year in which you do a BSc degree in a topic of your choosing, depending on what your university offers. So that would be, for example, neuroscience or management or something along those lines. It's a great opportunity for you to learn how to do research and just go really in depth into something that you're interested in. We haven't done it yet ourselves, obviously. We do it in our 4th year. But if you guys do have any questions about it, please do let us know. We'll try to answer them. Yeah. One more thing to say about intercalation is that it could be useful for you guys to mention in your applications. I know Sarah did in her interview.
Yeah, so for my interview, sorry, so for my interview, so for my Imperial interview, I basically went in and I was like, I want to go to Imperial because intercalation is really important to me, because it's something that I actually think is a great idea. It kind of provides you the platform to delve into your scientific passion, and to like actually do some research, not just medicine, do something apart from medicine, because I can imagine doing medicine your entire lifetime can be like for 5 years can be a bit, how do I say, a bit repetitive, or but doing a degree that kind of confirms your passion is something that's really helpful. And when being a doctor, I think when choosing the degree of medicine for you, you have to not only have the humanitarian side of like helping people, the communication, the empathy, all of that business, but it's also really important that you have your scientific passion, because you need both essentially. And so in my interview, I was basically like, I want to come to Imperial because you guys do the best intercalated degrees, and you have it as like something compulsory. Also because not a lot of universities were offering it at the time. I think the only ones that did it compulsory was like Imperial, Leeds and Oxbridge, I think. And then for Queen Mary and King's and all the other universities, they were like optional, but they were competitive. So you had to be like top 30% to do them. I know now it's changed. I think most people just do it as optional. or you have to apply for it and somehow. But I do think that's really helpful, especially when you're applying for your foundation years as a junior doctor. But yeah, I think that's about all we have to say about intercalation.
Yeah, that's it for preclinical years. If you guys have any questions about that, then please do let us know. But yeah.
Okay, so now we're going to talk about the clinical years. In my opinion, clinical years are very self-explanatory. What you do is you go into hospital, you go into placement, you go into GPs, and you essentially do a wide variety of things. You shadow a consultant, you work with junior doctors, you do sometimes junior doctors' jobs, you work with HCAs, you do some nurse jobs as well, like OBS, depending on which, like at what point you are in the year essentially, or which point you are in the medical school hierarchy. So in our experience, so my experience, I did a medicine placement in second year. It was only 3 weeks because obviously preclinical years, so we don't do a lot. So my medicine placement basically meant I just literally shadowed a consultant, did some observations for the nurses, took some mental capacity tests on the patients. It's essentially just patient interaction, history taking, all of those bits and bobs. But the higher you go in the years, in the clinical years, the more jobs you have to do and the more sign-offs you have to sign off. So sign-offs are basically what the GMC requires you to know at that stage of your medical school. So in third year, it requires you to have the skill and the like signed by a consultant that you know how to do this. So like blood test takings, and a whole loads of stuff. And as you go along the years, there are more sign-offs, there are more things you need to know how to do. And you get taught them either through small group teaching with the consultant, or one-to-one with the junior doctor, or with a clinical teaching fellow, so just one teaching fellow for the whole hospital. So it depends on which hospital you're at. Some universities will have better hospital teaching hospitals, and some universities won't have good ones. Some universities will require you to travel out far, so like all the way. So I know like some London hospitals require you to go all the way to Plymouth or Cornwall, or basically across the coastline. Whereas at Imperial, all their teaching hospitals are within the M25. Literally, like they're all London hospitals. I think because we have the Imperial College Healthcare Trust, which is a big trust. But yeah, I think that's one of the best things about Imperial for me, was the fact that all the hospitals are in London, and I wouldn't have to kind of worry about moving out. So if that's something that you like don't know, or something you want to take into consideration, it's definitely something you should, before you choose your hospitals, like universities that you apply for, look at which hospitals they train their students at. Yeah, I think that's all I have to say about
Yeah, one other thing to say about like London hospitals in general. So obviously, depending on, say you apply to out of London university, you would probably be studying your clinical years in an out of London hospital. Generally, from what we've heard, hospitals that are outside of London tend to be obviously less busy because they're not in the capital, and therefore the doctors and the consultants have a lot more time to be teaching you. So there's a lot more one-on-one sort of teaching, whereas that could be a bit difficult in London hospitals. That's something to keep in mind if you guys like are more interested in like kind of more one-on-one and like learning a bit more in that sense. It could be a bit more difficult in London hospitals.
But I think with London hospitals, you get to see a wider range of stuff. So all the like interesting cases across the nation get sent to specialized hospitals. We have loads of specialized hospitals in London. Not to say there are specialized hospitals in Manchester and Birmingham, all the big cities, but in London there are loads of specialized hospitals. Like just off my head, I know St. Mark's for gastro, loads of like Moorfields for ophthalmology, and all of those like specialized hospitals. There are loads in London, so you get to see kind of like a wider range of cases. But like when I said, it's a lot busier in London. I think all the hospitals in London are always at breach. Literally, like, you can't go into an A&E and actually get served within the 4 hours. Well, you can, but like very rarely. Whereas outside London hospitals, they're never in breach. They kind of always, yeah, they're always better. But the consultants, like Mona said, sometimes they don't have enough time, and they do a lot of private work. So they do a morning with the NHS, so they'll be with you in the morning, and then in the afternoon they'll kind of disappear, and you're like,
where'd they go?
And then you're stuck with the junior doctors and the nurses. But your junior doctors and the nurses are your best friends in clinical.
They are lovely.
They are literally your best friends. Like, they're the ones who will actually teach you your degree. Consultants, they just get paid.
Yeah. What else to say about clinical? I mean, my personal experience in the short clinical placement we had, I was in surgery for 3 weeks, which was actually really fun. I'd never experienced surgery and work experience or anything before. So it was quite exciting. A lot of like standing up, obviously during the theatre, because they take hours. So that was an experience, but it was genuinely really fun. And I was lucky enough to have a consultant that was really sweet, and he would, in the middle of the surgery, kind of like take the time to explain everything that was going on and like explain the science behind the illness that this person had, etc. So it was a really valuable experience. And obviously we were both in GPs for a while to do some like clinical communication stuff. But yeah, clinical years are kind of simple in the sense that you just go on rotations. There's not much else to say apart from like your responsibilities increase.
Yeah. If you watch like Grey's Anatomy and like what's the other one, House MD, it's literally,
you know what it is.
Yeah, it's literally going around
like shadowing a consultant or a doctor or something.
Yeah.
So yeah, that's all we have to say about the clinical years.
I think something that we need to mention is that we both are medical students in London. So Mona and myself, we've only kind of experienced a city university like experience. We haven't had the campus university experience. But personally, I love living in London. I love the buzz. I love the people. I love the the diversity you get here. I think, especially at Imperial, and I think most universities in London, there's always a society that you can blend in with. There's always like the sense of belonging. And I just, there's so many food places around uni, like we're
still checking them off.
Literally still ticking them off. And we've been here for so long. Well, not that long, but yeah, so I think living in London, don't get me wrong, it's really expensive.
Yeah, that's the con.
Really expensive, but it's got a lot more pros, I think.
It's expensive, and also it's possible that you would have to travel between, like, say you live out from university and you live somewhere in London. It's possible that you might have to commute a little bit to get to your hospital, depending on where you live, or commute to get to the campus. But at the end of the day, it's like you get used to it, especially since the transport system's so like well connected. And I'm the same, I wouldn't give it up. So it sounds like we're trying to sell London universities. But honestly, any university that does medicine, at the end of the day, if you study medicine there, you're going to end up a doctor. Yeah. But we're just saying that we really enjoy the London experience.
Yeah, any university you go to, you'll graduate as a doctor. So it doesn't matter which university you are. I think just if you're really interested in taking your career into like a higher level, maybe look at the opportunities and the resources that are available to you from that university. So which doors can be open for you. Like, for example, at Imperial, they do a lot of research. That's something that maybe you want to take into consideration. In other universities, they might be better at communication or, I don't know, conferences. I can't think on the top of my head, but something like that, yeah?
Yeah. So now everyone, please ask any questions in the Q&A section about anything, if it's to do with the application, if it's to do with our experiences, or maybe even about something that we haven't personally experienced, like campus, universities. I'm sure we'll know a little bit, hopefully, so that we can help you. We hope that this webinar has been useful in terms of explaining everything. We'll be going through the Q&A now. Just quickly before we do though, as you can see the posters, we have a UK CAT course coming up on Monday. So please sign up if you're interested in learning all the tips and tricks of the trade for verbal reasoning. And we also have a webinar, again, 5 p.m. next week, so Wednesday next week, about coronavirus and how it will affect your application. And the week after, we haven't got the poster here, but the week after will be on a doctor's life, hopefully. So yeah, again, follow our Instagram into @medicine. Yeah, so now we'll be
follow us. I'm trying to see the questions. Mona, can you see them?
Yes, I can.
I can't see the questions.
Okay, fine. So the first one is, how did you prepare for the UK CAT/BMAT? Do you want to go?
Yeah. So that's actually a really good question. So whoever asked that, thank you. I think I prepared for the UK CAT a bit differently to the normal. So can you hear me?
Yeah.
Yeah. So for the UK CAT, I started preparing maybe 6 weeks in advance. So I spent kind of like a month and a half doing questions on Medify. Shout out Medify if you haven't used Medify.
In hindsight, I should have used Medify for longer. That's what I should have
done. So I spent like the first 4 weeks till my UK CAT doing like 2-3 hours a day. So I picked out like a section and I would do like a section a day. And then I did like, I think I did one past paper. I think they only give you like 4, I think. So I did one every week up till my exam, and then I used like Medic Portal for some other past papers for the UK CAT.
Yeah, essentially, guys, it's practice questions. Keep doing all the questions you can. Look online. I'm sure there's loads. Medify is really good. It is paid, but we wouldn't recommend it if it wasn't good.
Yeah.
It's the reason why it's good is because it like simulates the exam conditions in the sense that it times it for you and tells you how long each thing took for you and stuff like that, so you know what to work on. So definitely check it out, Medify. Online.
I would say start as early as possible. Like I know people who crammed their UCAT revision in the last 2 weeks or the last week before their exam, and then they regretted it. But some people, they crammed their revision and then they did really well. They got in the 700s. But I felt like I just did better because I did it very consistently for a couple of weeks.
Yeah.
I didn't do that much towards the end. Like I was only doing, like I said, I only did like 2 hours, 3 hours a day, even towards the end. But I do feel like it was very helpful.
Yeah.
So I did average in the 700s in the end, but it's just practice.
Okay, cool. So the next question is, we have a few. We have about 7 more or so. Considering how demanding medicine is, what is the social life balance like?
Oh, do you want to go for this one?
Yeah. I mean, personally, I genuinely found I had more of a social life in uni than I did at A levels by far. You will definitely have a social life. You can't avoid it because it's uni and you end up socializing all the time, especially in first term of first year. Like, I don't think I worked at all in that point, but no one did, so it's normal.
I think people went to lectures to socialize.
I still do that. I go to lectures to socialize. It's literally, don't worry about lack of socialization.
I think people lie. I genuinely think I think maybe it's different when you're older, but I think definitely in the first couple years of uni, when you're submerged in societies and literally, I think Mona and myself, like our friendship group, all of them are like presidents of societies at this point.
Oh yeah, Imperial has the biggest number of social societies of any university in the UK.
We have like our own societies for the Faculty of Medicine. I think we've got like 90 societies for Faculty of Medicine, just medicine, like just medic.
And they do events like every day. So you will have, and outside of uni, you have like it's the London life. Do you know what I mean? So we have, even if it's not in London, I'm sure like there's lots to do. So I wouldn't worry about social life balance as long as my advice would be to keep consistent. So if you just do a little bit of work every day, then you'll be on top of everything, I promise. The only time that I would say your social life is gone is exam season, but I guess it was the same for A levels and GCSEs for me as well. And exam season isn't even that long, really. It's like, what, a month? I don't even know. So apart from that, I would say it's quite a good social life balance.
Yeah. And I think the best thing at Imperial is that all our exams are at the end. We don't have any, that old curriculum. The new curriculum have exams throughout the year. But I think with us, I think the best thing was that we didn't have any exams throughout the year. So we basically mucked about first term and second term. And then third term came and nobody saw us.
No, we went there.
Library socializing, just library time.
The next question, if we should move on. The next question is, what should you look for in a university when applying, and what distinguishes between universities?
So I guess that's kind of a question that you should ask yourself. So what do you look for in a university? For me, what I looked for was geographical location, to be honest. So I looked for just universities in London when I was applying, and then I looked for universities that would accept me. So with my UK CAT score, with my
same
predicted grades, and then I obviously applied for Imperial. But the thing is with Imperial is because we sat our BMAT after we applied. So you sit your BMAT exam once you've chosen which universities you want to go to.
It's a bit of a risk.
Yeah, it's a bit of a risk. So if you don't do well in your BMAT, it's if you apply for 2 BMAT universities and then you don't do well in your BMAT, you automatically, expecting rejections from 2 universities.
Well, I would say that nowadays it's more common for people to do the earlier BMAT, I think, unless that's not a thing anymore.
I think now you can do September 1, but I'm not sure which universities accept the September 1.
Yeah.
I'm not really
That's something to look up. You can easily find that information, don't worry.
What was the second part of the question?
What distinguishes between universities? We've already mentioned a few things, such as whether they do intercalation, the research aspect. I guess you could look at, for example, I don't know, like because we're at Imperial, we always hear people saying, oh, we have really great teachers because it's a leader of STEM teaching in the globe or something. So I guess if you're interested in that. Other thing, again, things that distinguish it could be the social life or like the demographic that's there. It's a lot of different things. I would say, however, I mean, the big things would be intercalation and the teaching style. The rest I would say is kind of like similar in most universities, because as I said before, at the end of the day you will end up being a doctor. Maybe that's just me being unpicky, as I always am, but that's my opinion anyway. Sorry.
Basically what you said. Yeah.
Okay, cool. I hope that answers your question. If not, let us know. Okay, the next one is we kind of already answered it, but again, it's what is the social life like at Imperial? So we already said the Imperial social.
Can I just address this? I think most people think that Imperial students don't have a social life.
Oh yeah, there's. To be honest, that's a big.
Okay, well.
It's not okay. It might be true for the rest of the university. It might be true for the rest of the university, but not medics. Medics have fun.
Not medics. Honestly, I think medics are the least serious candidates. Like, don't talk to engineers. I don't talk to them. They're scary.
Also, I think social life wise as well, I've noticed when I speak to my friends who go to other universities, we the whole year I think has a lot of friends in older years for some reason. I don't know why. I think it's because the medicine community is quite like tight knit. So other universities, my friends would be like, what the hell, why would you even talk to people in the older years? But it's genuinely like we just enjoy our time with them. We just go out, have dinner or whatever. I would say it's a myth that we don't have a social life, but people do take like studying seriously, especially other courses. Like the library is always packed and things like that.
I think you learn how to kind of do it all. Like you learn how to socialize and revise. You learn to stay in the library a couple hours and then go out with your friends. Or like
it's definitely a balance.
Yeah, there is a balance. Like you learn how to balance your life, which maybe in A-levels you weren't able to do, but in uni you are.
Okay, cool. So the next one is, what is a typical timetable like? So we'll start with preclinical, I think. Let's talk about preclinical and then clinical stuff, because it differs, but the timetables are a bit different. So you can go first.
Yeah. So preclinical years, I think it depends on which university you go to, and it depends if you're doing the new curriculum, old curriculum, and Imperial. I think old curriculum, we had loads of lectures. I think we had like
all the time. It was quite common. Like the majority of our days would be 9 to 5.
9 to 5, 9 to 6 sometimes.
Obviously, because it's not just lectures, you have tutorials and labs and all of that, and it all adds up. So you need a 9 to 5 day.
The only day of the week that we had a half day, I think in first year, the only day of the week that we had a half day was Wednesday. So Wednesday afternoon, you got to do sport.
Yeah, because it's sports night on Wednesdays. So we have that afternoon off.
But that's it. With
I'll admit it's hard. Yeah. Well, second year was more flexible by far.
We went in maybe 4 days a week.
something like that. Yeah.
Maybe.
The new timetable does offer a lot more. Okay, so the new timetable for which is more relevant to you guys listening, obviously, in terms of Imperial, it has a lot more independent learning. So they've introduced a lot more online learning with software like Coursera, which so you're expected to do your own like pre-reading and post-reading to solidify and consolidate everything. So that's like takes out contact hours. However, there are like, compared to other courses, medicine will remain quite high contact hours at the end of the day. So I would say it's long days, and sometimes it's tiring, depends on what time of year it is. At the beginning, it's not that tiring. Closer to exams, a bit more stressful.
Yeah, I remember first year, third term, we would have like, especially like literally 2 weeks before our first exam, we were still doing lectures 9 to 5.
Well, there was one day when it was like 9 to 6 and I wanted to cry or something. It was a long day.
I think because we're Muslim, we were fasting.
Oh yeah.
I was like, at this point, what am I even studying? But it was, I think it's better now. You get used to it.
Yeah, oh, definitely. Like, it's not, as I said, medics have fun. Like, it's not unmanageable. I definitely think that I had a lot more fun in the past 2 years. Sometimes a bit too much fun. Did I turn up to some lectures? Possibly not. But it was really enjoyable. So it is, the truth is, long timetables, but at the end of the day, it is manageable. If we can do it, then so can you. Don't worry. Next question is, do you have any advice for MMI versus panel interviews? Go.
Okay, so most universities do MMI now.
Even Imperial. It wasn't when we applied, but it is now.
When we did our interviews, we did panel, but now they're all doing MMI. MMI is a fairer system.
A lot.
Just in case you don't know what MMI is and what panel is, the difference between MMI and panel is in its name. MMIs are multiple mini interviews or mini multiple interviews. Whereas panel is basically you sit on a table, there's like 5 people sitting in front of you and they're all asking you questions. Whereas MMI is you go to stations, and then in the stations they assess you on a particular factor. So in a station they'll assess your communication skills, in one other station they'll assess your empathy skills, in another station they'll assess your passion for medicine, your passion for research, your extracurricular activities. So it tends to be a lot fairer because you can do a station and then not do well, but then you can start a station and do perfectly well the next one. So it gives you that chance to kind of redeem yourself. Whereas with panel, if you mess up the first question, you're kind of going downhill from there. Not to say that you can always stop and be like, can I start over?
Yeah.
But was it how to prepare for different styles?
Yeah, what was your advice?
Oh, yeah. So my advice would be just go through all the questions possibly that they could possibly ask you for MMI and for panel. They're the same questions, they're just set up differently. With MMI, you have more questions. Panel, you have less questions. But you just go through all the questions with yourself, with the wall, with your mum, with your friends. Just
definitely.
All the questions.
I spoke to the mirror all day. I remember interviews. I was really especially nervous for interviews because I hated them. It made me want to cry. But honestly, my advice now looking back would be, don't deep it too much. Just prepare as much as you can. I'm sure you guys, like, if you have a friend who will help you answer the questions, time yourself. I remember I even asked some of my teachers to help me, like literally random teachers that didn't even teach me, but I knew that they, I don't know, were nice. So I literally went up to them in school. I'd be like, can I have you help me for like half an hour, please? And they'd sit, and I did the same with personal statements, but they would like ask me a few questions, then they'd give me their opinions, and I spoke to the mirror a lot. So as long as you practice all the basic questions, like why medicine, why this university, practice other things like ethics, other things like decision making. What else is there? I can't remember. Oh, role play. Definitely practice role play, I would say.
It was such a dodgy station. I'm not even gonna lie to you. I did 2 MMI interviews and 2 panel interviews. So my panel was Queen Mary and Imperial, and my MMIs were King's and St. George's. And my King's role play was like someone is suicidal, help them. And then my St. George's one was you're a waitress at a cafe.
I had the same one as St. George's.
You double book someone in, deal with the client who's now shouting at you. So the role plays are so random, but you just have to basically
Stay
be
calm.
a good person. You just have to be a good person. You literally just have to show that you are normal and you're not rude and you're not aggressive.
And that you want to help them. So don't just sit there and say, oh, I'm sorry. Say it was the waitress situation. You'd be, I'm so sorry. I understand why. I understand this is completely our fault. It's nothing on your part. I will try my best to help. So I'll talk to the manager. And then you give them, like, perhaps if you could, a alternative. So you could say, there's a restaurant down the road. I will ring them up now and see if you guys can go there now, or something like that. So yeah, just be creative with it. It's not too deep. So that's my advice. Panel interview wise, unless it's Oxbridge, I would say they're a lot simpler than MMI. It's honestly just to know that you're human and that you don't say anything too dodgy, honestly. So for example, I know that there was a question once and it was like, what would you do if you were a medical student and there's a consultant who was like drunk on the job? And the person basically said, I like heard a rumor that the person basically said, oh, I wouldn't do anything. Like, that's immediately a no-no. So you like, in those kinds of scenarios, you know, you have to report them and things like that.
It's basically like the same SJT that you talk about in your UCAT. Yeah, with your UCAT. It's the same medical ethics that you have to know for the UCAT. You do it for the interview with a little bit more kind of knowledge. So you need to know your 5 pillars and your whole, like, what makes you
they give you a scenario or something, and what would you do in the scenario? I can't remember really. The other thing I would say with panel interviews is Oxbridge is completely different. So everything we just said is different for Oxbridge. They're very, very scientific. They will probably ask you a scientific question and see your reasoning behind it. I honestly, because I personally didn't have an Oxbridge interview, I don't really know the process behind it a lot, but I know people who like had completely random questions thrown at them. But again, it's kind of like they're not expecting you to know the answer. They're expecting you to work through it. They will ask you, so don't worry if you are applying there and you come up with a question, you're like, oh, I don't know the answer. That's okay. So you like work through things, like basically say what you're thinking and then ask some questions and stuff like that. They're not too scary. So yeah.
And they're not allowed to reject you on something that you don't know, that you should not know. So like,
exactly.
if they ask you something, like, I know my friend was asked about like what a DVT is and how she would treat it. She didn't even know what a DVT was, and then they were like, okay, don't worry, we'll ask you about something else.
Yeah, okay, cool. So I think that's that. If you have any other questions, again, ask. I hope that answers it though. Done. The next question is, what are your tips in settling in the first few weeks of the medicine course? Thanks. Yeah, so tips on settling in.
So freshers week,
freshers fortnight imperial, because for some reason we have a fortnight. Or is it still a fortnight?
It's, by the way, only medics have a fortnight. The rest of the week have a week.
Was loads of fun.
Medics are like social animals. I don't know. They just like
I would say my personal advice is don't stress, because freshers, the first few weeks, you will never, like, everyone is so lovely and open, like, because everyone is really trying an effort to like find friends and things like that. You're not like alone. There are other people like everyone is in the same boat. So everyone will literally be asking your name. You'll get sick of introducing yourself by the end of the 2 weeks. But it'll be worth it. Like, you'll speak to loads of people. It's possible, definitely, that you speak to some people that you won't ever speak to again. That's really common. I know I spoke to Sarah the first time at Freshers Fair, which is fun. But I think
something to mention as well is, if you're living at home and you're worried about being a fresher and there's other people, because most people in Freshers Fortnight or Freshers Week, whatever, will hang about with the people they live in accommodation with.
Yes.
Their flatmates. But you don't realise that literally come end of term, you're not with the same people you were in Freshers Fortnight. You probably won't even speak to them again. You know the amount of times I introduced myself to exactly the same person?
Yeah, because they forget. I forget as well. I forget their names.
And a lot of people that really enjoy Freshers Fortnight will go out and like party, and then the next morning they won't even remember anybody. So that's something that happens. It's very normal. Just, I wouldn't worry. Everyone, nobody has friends when they come to uni. Nobody has friends with nobody. Especially now with
you will find your people.
Like that. You will find your people, whether through societies. So that's why join societies.
Definitely join societies. Yes.
Societies. Go to all the events. Don't worry about studying. Please don't come on your first term and like I'm going to the library. I swear to God, don't do that.
I didn't go to the library until second term, at least. I would say I would say also, if you're moving out, it's definitely daunting. Don't worry though, everyone is in the same boat. And if you, like, you'll be living with other people. And honestly, most of the people, like us two personally, we didn't move out, but most of my friends moved out. And they made very, very, very close friends with their housemates or flatmates or whatever, the people in their halls. They're very close. So don't, just kind of be yourself, be open, go to loads of events. If you're comfortable with, obviously. There'll be loads of different types. So we went, I don't know, I went on like a picnic or something. It was in Hyde Park. That was cute. Went bowling. It was fun. So yeah, my tips would just be, don't sweat it. Just enjoy yourself. Be open. Everyone else will. And enjoy it, because Freshers' Fair is like the most fun time.
I had fun Freshers' Fair in second year as well, when I wasn't even a
Oh yeah, I went to all the Freshers' events as well in second year. It was so fun. I hope that answered it. So yeah, don't worry about it, but you will definitely end up settling in. Uni is the time where you like find your people and find yourself. So yeah. Okay, the next question is, what's the best way to manage both BMAT and UK CAT? So I'm assuming this means because like you'll be taking them like at a similar time, or maybe, I don't know.
I say do the UK CAT before you do the BMAT. Don't do it at the same time.
Yeah.
Personally. So
I mean,
in August and then start revising for your BMAT.
Yeah.
So you could do both at the same time, but they're different revisions.
The current advice because of the whole COVID situation is to take your UK CAT as early as you can. So I'd say, basically, I didn't even think about my BMAT until I finished my UK CAT. So I would say, look at your UK CAT, as we said, Medify, practice questions, all of that jazz. Do that. The advice is to do it as soon as you can. Again, guys, if you haven't booked it already and you're applying this year, then definitely go and book it now. I think you can do it at home or in the centre. We'll be talking about that in next week's webinar and stuff. So there's that. Then you can focus on your BMAT. Again, you'll have a lot on your mind, like personal statement or whatever. So again, yeah, it's a bit stressful, I'll admit, but it will pass. So BMAT wise, the way I prepared was I did loads of practice questions. I'm pretty sure all of the past questions are online on the website. They have loads of past papers, so I just did all of them. At the beginning, not in timed condition, and at the end, I did quite a few in timed condition. Yes, practice the essays, get people to read over your essays. I literally went to random English teachers in my school and I was like, please read over this, and they're like, okay. So yes, what else did I do for BMAT?
So are there any more questions?
Yeah, there are 3 more questions. Well, we can go through them quickly or not. Yeah. I don't know. Yeah, we're kind of over time, but it's okay. So that's that. But yeah, don't worry. Just focus on UK CAT, then BMAT. Yeah. During preclinical years in London, if your accommodation is very close to the university, is it worth getting an Oyster card for travel? This is a good question. So you should definitely get a student Oyster when you begin anyway, because a student Oyster is like, it allows you to get a third off travel cards. So just get the student Oyster. It's like a one-off payment just for the card. I think what you're asking is it worth getting a travel card? So that's basically when you pay, say, monthly or something, which allows you to, like, if you travel a lot, then you'll pay off. I would say in Freshers' Fortnight or like the first term is probably worth it, because you will go to a lot of events if you're quite a sociable person and stuff like that. So I'd say it's worth it then. If you live close to the campus, then probably not, because there are some people who are in walking distance. Yeah. So this is after like all of the socializing is done, probably in second term. I know a lot of people didn't, and whenever they'd go out, they'd just pay the £1.60 for the tube or whatever, which kind of worked out cheaper. You will work it out when you get there, but I would say for the first couple weeks, definitely get a travel card for like, say, a week or 2 or a month or something.
Also, because some accommodations that may be on campus, or like Imperial, like got Bright, Southside, Eastside, all those accommodation blocks are on campus, but then we would have lectures in Charing Cross Hospital.
Yeah, but that's, yeah.
Hospital. So, no, but that was even in first year.
True.
Even in first term when we did anatomy, we would have to go to the hospital. So that's something that maybe you want to take into consideration. Look at your timetable before deciding if you're going to get a travel card or not.
Yeah. So, you can like figure it out once you get there, because then you'll figure out, oh, how am I going to be getting to this place? What's the prices like? What's the single payment like versus travel card? But yeah, you'll figure that out once after Freshers.
Whoever like your medic flatmates are,
definitely
see what they're doing, and then just,
Yeah. Yes, so there's that. Do you have to attend uni every day? So let's go. So the answer is, technically they would want you to attend lectures and everything. So most things are like, what's it called? Registered. So you have to bring in your ID, maybe they'll scan you in, maybe you'll just register saying that you're in. So these are things like anatomy, labs, tutorials, they expect you to be there. So I would say you have to be in there for those.
The things that you get signed in for, you have to be there.
Definitely. For us personally, we weren't signed in for lectures. I know some universities, so for example, Brighton, because it's such a small cohort, we have like 360 people in our year, but Brighton is a very small cohort, so they would pass around a paper for every lecture, and they'd expect you to be there. It depends on your university. So again, if it's compulsory, then it's compulsory.
We had to be there, but we didn't have to be there.
Technically they wanted us to be at lectures, but a lot of people end up skipping lectures, not because they're not learning, but because they have recordings at Imperial, and they also put up the slides beforehand and things like that. So some people learn that way without going into the lectures. But again, a lot of people find the lectures really useful. Like I know, especially in our year, a lot of people go anyway, even if we have the recordings.
Exactly. But a lot of people didn't come in. Like I remember lecture theatre was like 350 people. There would be 50 of us.
But like by the end of the year, yeah. At the beginning, everyone turns up. It's like a packed lecture theatre.
Beginning to socialise. Let's not.
Yeah.
True.
Yeah. So that's the answer. The answer is yes. You do have to attend. You're expected to attend. But if your university doesn't have lectures that are registered, then even the lecturers will know that a lot of people won't attend. So that's the answer. I hope it answers your question. You will find out whether lectures work for you or not later on. Next question is it possible to take a gap year or like a year out? I think do you mean before uni, or I think you mean before uni, so like a gap year. The answer is yes, you can take a gap year. I know a lot of people that took gap years. I even know people in the year below who are like our age, and they took a gap year, which is why they're in the year below. It's common. What you would have to do though is like incorporate that into your personal statement, and they will probably ask you questions about what you did in your gap year in your interview and things like that. Again, all of advice for like these sorts of questions you can find that easy online. I remember seeing loads of that, because it's common for people to take gap years, but I would say do something in your gap year that you can talk about. I don't really know what, maybe volunteering or something like that. So relate it back to medicine. What about you, Sarah? What's your advice?
Basically what you said. A lot of people take gap years and they do amazing things in their gap year, and then they come back and they showcase how amazing they are, and then all the universities want them. So
basically, yeah. Yeah. It's definitely possible. I know some people even defer a year and stuff like that. So the last question that we have is the content too hard to grasp compared to A levels? This is a good question, actually. I remember thinking this. The content is difficult. Like the first few days, it won't be difficult. It will basically be A-level biology, right? I remember doing stuff and I was like, oh, I know this. The content is difficult because it's preclinical and it's very sciencey. Again, it depends on university. Every university will teach differently. I remember being completely thrown by I was like, why is there so much science? Why am I doing biomedicine?
Like, really? Was the Krebs cycle even necessary in first year?
The Krebs cycle, you think you have to go in depth with like respiration in A levels. Wait till you get to uni, but
literally, or like pharmacology. Like, is it really necessary to learn all these chemistry molecules? But
that's not to scare you though, because if we can do it, anyone can. It's difficult content, but it's uni. It's going to be harder anyway because it's further education. As I said, I think personally, my experience with medicine is that the content is okay to grasp. I wouldn't say it's easy peasy, but I would say it's okay. But the main issue is the huge sheer amount of content. Like my brain couldn't absorb all of it. There's a lot of memorization involved because you just learn so much. That's my personal experience.
Yeah. Basically, it's okay. It's manageable.
Yeah, definitely. We made it this far. You guys will as well. Yeah, definitely. I remember. The content is difficult. I wouldn't say it's easy, but definitely manageable. just prepare yourself for a lot of memorization.
I don't think your problem's going to be how hard this stuff is. The
Definitely
stuff
not.
taught well. You don't get to a point and you're like, I don't understand this. And
also, there's loads of resources.
Societies that will teach you it. Like all the years will teach you all the time. But it's just grasping how much there is to know.
There's a lot of online resources. Basically, there's loads of, as Sarah mentioned, the societies that do tutorials like after hours, so like from like 5 to 6 or something like that, or 6 to 7 or whatever. Well, I don't even know when it was, to be honest.
Then it's like 10:30 p.m.
Oh yeah, so basically they like older years will like basically take time out of their day to teach you content for free or whatever, it doesn't matter. And these are really good opportunities for you to ask questions again directly to the older years who kind of know a bit more. So there's plenty of support. I wouldn't worry about the content. Just prepare yourself for a lot of memorization during exam season. It's the kind of thing that you have to pace yourself. As I said, do a little bit of work every day. Exam season, you have to like do a bit harder, a bit more work, sorry. But yeah. And fine, one more final question. What is pastoral like? So pastoral is like support that you get, right? From university, isn't it?
Yeah.
Yeah, so pastoral at Imperial
is actually quite good.
Yeah.
It's not as bad as people think. Go on, Mona.
Yeah. No, I was going to say
quite a lot. Like if you're stressed, if you're going through financial problems, they'll give you money. Like they want you to have a good time at uni.
Yeah. They have a really good bursary system at Imperial. I know a lot of my friends literally chose Imperial because of its bursary system, which is really good. Otherwise, Imperial, especially in recent years, has had a lot of emphasis on well-being and mental health and things like that. They every term basically they will give us a lecture on like I don't know, study skills and things like that, and within that they'll talk about well-being. They also constantly remind us about things like applying for mitigating circumstances, because there's a whole system that you have to go through the university. They have a counselling system. They have other sort of well-being lectures, and not lectures but like workshops a lot. Like there are well-being workshops happening all the time about different topics, say revising or dealing with stress or sleep or looking after yourself, living away from home and things like that. So if you have an issue, then it's very easy to contact people. You will know who to contact because they will tell you from day one that in the first they
tell you like every term as well. They'll like give you every time, they'll come and be like, if anybody's going through anything, these are the people you need to contact. You have a personal tutor. Tutor, like you have different tutors for like one for your health, one for your academics.
Your academic tutor actually is very, like personally, my academic tutor, she's so sweet. She's like a GP, she's very sweet. She works with the university and she would like send us a lot of emails a lot of the time, just checking up on us and being like, I know your exams are soon. If anyone needs anything, I'm here for you and stuff like that. She even did Zoom calls. Bless her. She did Zoom calls with us because of this whole like corona stuff.
So it was very sweet. He was like, if you're feeling any like stress because of the pandemic and the exams, then don't worry, I'll like put in a mitigating circumstance for you guys. Like, and we're fine. Like we're actually fine. Relax.
And they would for example, if we had an issue, so we had like some issues with the exams this year, obviously, so did every university, which a lot of the year was really stressed about. So essentially everyone would go talk to their academic tutors because that is like kind of one of your first points of call. And bless them, I know the academic tutors would all basically go and talk to faculty on your behalf and stuff like that. So there's always someone to talk to. Even health wise, you have occupational health and stuff, if you guys have any concerns with that. So I would say pastoral is good, because I think I heard rumors before that pastoral wasn't really good or something, but then I got to you and I was like, oh, there's a lot of support available.
I guess it depends on your luck as well, to be honest with you. I know there are stories that some students don't have good luck with their tutors, don't have good luck with their faculty. Definitely. So it depends on,
But there will be other like points of call. Say your academic tutor perhaps isn't attentive or something, then you will definitely know who to contact, because as I said, from day one they will be like, here's who to contact in this situation, here's who to contact in this situation, etc., etc. So
shall we conclude now?
Yes, that was the final question. We hope that this was useful. Thank you everyone for staying. I know we've overrun 15 minutes. Whoever's still here, props to you. Impressive.
Thank you so much, honestly. But yeah, we hope to see you guys in further courses and
Yes.
webinars next week.
Definitely next week's webinar will be very useful in terms of coronavirus and like what you need to know and how it affects you and what you need to know personally, like